Hello Jane, how are you?
I'm very well, thank you, Diana.
Good. I'm glad you've joined me today because I have a series of questions that I would like to ask you. And the first question is, can you tell us more about your team and the work they needed to do during the initial stages of the pandemic?
Thank you, Diana. Yes, so during the pandemic, and particularly the early stages, my team at Bedfordshire, Luton and Milton Keynes CCG, the Clinical Commissioning Group, was part of the Warn and Inform network, which is part of the emergency response. And we were very much part of a team effort to take messages that were coming from nationally about COVID and to turn those into simple messages for all the population who lived in Bedfordshire, Milton Keynes and Luton. So every day we would be on a number of calls with partners in the police, the fire service, the local authorities, the hospitals, the ambulance trust, so that we were able to understand the situation and to be able to respond to requests from frontline staff to get messages out through the media channels, through the social media channels, to help people understand what was going on and to protect themselves. One of the biggest challenges was the fast pace that the pandemic was moving, in terms of trying to understand what the accurate position was at the time and to be able to respond in a timely manner to all the different needs that were coming, whether it was from frontline staff, whether it was from our regional and national colleagues who were wanting information about what was going on, and how we were able to work in such a way that we could provide round-the-clock service, weekends and evenings and nights too, to be able to get the information, the most accurate information. And as you'll appreciate, things change very quickly to the right people at the right time, but also in a way that people could understand them. And you'll appreciate, like I do, the communities that we serve here in Bedfordshire, Luton and Milton Keynes are all very different with very different means. And I think one of the lessons we've learnt in terms of how to engage and communicate and listen to those people who live locally is by working with the community leaders, the faith leaders, the people on the ground who are trusted voices, who we can talk to and rely on them communicating and engaging and listening to people locally. It's absolutely critical when you work in the health service, and particularly in the clinical commissioning group where we buy the healthcare for the population living locally, that we understand what patients and the public need. And those needs change depending on where you are in your life and your personal circumstances. And I think it's absolutely critical that we in the health service are able to provide a service that is very much driven and centred by patient and public views. And whether you're in a pandemic or not, that doesn't go away. And I think it's even more important as we prepare for the winter with all of the challenges that brings, as we prepare for a second wave, that we're able to take the learning from the last 6 months and to apply that now and to keep that continual conversation. And I can assure you that the feedback that we get means a lot, because we're able to adapt and adopt services as we go along. There are lots of opportunities for us as communications and engagement people as we develop as one clinical commissioning group representing a population of just shy of 1 million people across Bedfordshire, Milton Keynes and Luton. There are many fantastic things happening in each of the council areas, and it's a great opportunity for us to share those and to make sure that that good work is spread and being used right across. Equally, it's important that we don't lose that local focus, and I think that's one of the things that we've learned and heard a lot over the last few months as we've engaged during the merger process, that people are really, really proud of what they've done locally and they don't want to lose that. And I think the opportunity for us is to work with our GPs who are very much our local trusted voices as we work as one clinical commissioning group, that will keep that local focus but be able to enable us to work at that more scale regional level. I think there are some very long-lasting benefits from having worked with colleagues, partners across the whole of the Bedfordshire, Luton and Milton Keynes area during COVID. And it's that close working relationship that you form when you're up against it. And those relationships now mean that we have a fantastic network of communications and engagement people right across the patch. Not only are we working in a different way, the use of social media has transformed the way that we're able to not only engage with people but listen, and to do this in such an instant way. And I'll give you an example. The way that we now communicate and engage with our different communities across Bedfordshire, Luton and Milton Keynes, by working with our GP colleagues who literally in minutes can film a short video that we're able to communicate through social media, with which thousands of people have been able to click onto and look at and understand in a language of their own, has been fantastic.
It certainly has, I think, revolutionised a lot of services for a lot of people and changed a lot of people's lives as well. And we are really aware that at very short notice, services have had to develop new procedures and new ways of working in order to make sure that service delivery can continue. So thank you very much for talking to me today.
No problem at all.
And keep safe, and I'll speak to you soon.